Welcome to Something to Ponder. I'm your host, Reggie Ponder, and this is where diversity and thought leadership converges. Please welcome Joe Gaspero.
Hi, I'm Joe Gaspero. I'm executive consultant with the Kaleidoscope Group, focusing on healthcare, and I'm also the co-founder and CEO of a nonprofit healthcare entity focusing on reducing healthcare disparities and health inequities called Center for Healthcare Innovation. Founded my organization about a decade ago. Really what we do is we look at how do we bring healthcare experts together from across the country to tackle the most pressing healthcare issues, such as lack of minority participation in clinical trials. Cultural competency has been a big theme of ours over the last several months. Also looking at social determinants of health and really looking at how the most underserved, at-risk, and vulnerable patients face the most health challenges and most health obstacles, and particularly patients of color.
So Joe, when you talk about starting this organization, why did you do that? What was your interest in saying, man, I need to tackle this issue?
Yeah, great question. So first, when you look at just some of the health disparity data in the U.S., you're actually not certain that you're looking at U.S. data. So by many metrics, the U.S. spends the most per capita on healthcare than any other country in the world, and just by about any metric, we don't rank anywhere near the top, in the top quartile. So if you look at prostate cancer rates in African American men, or breast cancer rates in African American women, minorities face disproportionate cancer rates and disproportionate health obstacles compared to other groups, minorities in general, Hispanic as well, Asian Americans. And so this is a real problem in the U.S. And health equity, I think, really cuts across all sectors of healthcare. And everybody's interested in health equity, whether they know it or not, because these are really big cost drivers. And so if you look at some chronic conditions such as diabetes or heart disease, different indications that disproportionately affect vulnerable patient populations, they really have a tendency to drive up costs. There's some estimates that estimate that the lifetime cost of someone with one or more chronic diseases can be as much as 14 times higher than an individual without chronic diseases. So these are really the major cost drivers in the U.S. healthcare economy.
But so when you talk about that economy or that ecosystem, isn't it good for that ecosystem to have those cost drivers, to have higher healthcare costs, to have higher prescription costs, to have more people in the system, as opposed to just making sure that everybody is doing well?
So in terms of those costs, those are cost drivers. They're unrelated to health outcomes, and I think that's really the most important. So when we think about healthcare, historically we conjure up these images of the acute care setting and physicians and doctors, and really when we think about healthcare, it's about healthy outcomes. And sometimes healthy outcomes, it's not related to being in the hospital or being in the doctor's office. It's related to what we eat, or what are we doing, what are our social structures, or how healthy what are the wellness things that we're doing to prevent us from going to the doctor in the first place. And so really it's about, when I talk about health outcomes, it's about how do we live the happiest and healthiest lives possible without driving up those costs. And so those costs for chronic diseases such as, I mentioned some of diabetes being a big one, they tremendously inflate costs in the healthcare economy.
And you were concerned about this because you used the word equity, but what was the personal driver there? Because this is so fascinating that you would say, okay, we're going to start a nonprofit organization that focuses on these inequities and try to firstly highlight them and then see what kind of policies and things that we can do to impact them. What was the driver for you?
Yeah, great question. One is just meeting some really interesting people at the right time in my life, and just being an opportunist and kind of getting the right people on the bus, and people that are passionate about healthcare, passionate about health disparities, and kind of putting together a core team to go ahead and launch our center was the first. And so, that's no secret that people, as Lovie Smith says, you got to have the right people on the bus. Another was just kind of seeing a market opportunities as well. And so, I talked a little bit about health equity. In addition to the obvious fact that everybody should live their happiest and healthiest lives, regardless of, what zip code we're born in or what kind of socioeconomic strata. that we're born into, there's a real market opportunities in terms of the X's and Y's and the financial implications of having a more equitable healthcare system. And so you're just seeing the kind of market opportunity was one. Another was kind of seeing a market gap. And so one of the things that our organization really tries to do is to bring all different sorts of healthcare stakeholders together for really thoughtful dialogue. So, not just packing a room full of physicians or a room full of pharmaceutical representatives or a room full of patients, really kind of bringing these cross-sectoral, interdisciplinary groups together to really tackle complex issues. And that's what we do. And we don't always have the answers. And we get into drug pricing, which has been an extremely, hot, polarizing topic in the U.S. But really kind of bringing thought leaders and key opinion leaders and patient advocates together for thoughtful dialogue. And then also, Reggie, what we try to do is to think about, what are some implementable solutions from some of these challenges. And so a lot of times when you think about these healthcare challenges, for one thing I mentioned was looking specifically at lack of minority participation in clinical trials. Bring people together to talk about really low-hanging fruit. How do we reimburse people for Uber rides for clinical trials? Or how do clinical trialists, research coordinators, and PIs, are there different things in the informed consent forms that can be more culturally competent? So really looking for kind of those low-hanging fruit best practices to tackle is kind of what we do. And again, we don't always claim to have all the answers because these can be incredibly complex topics. But when you bring the right people in the room for thoughtful dialogue, there's definitely, you create a lot of value.
So I actually want to dig in on this a little bit because I've seen on TV that recently that there's a number of commercials that will ask people to be part of these trials, and I think that it seems to be a little broader than I can kind of remember in terms of growing up, in terms of trying to ask a broad audience to. Seems like it's trying to be inclusive. Would you say that that's been the experience that for these clinical trials that they've kind of got the message that you need to be a little bit more inclusive and broader in terms of trying to do these things?
So a journey of 1,000 miles starts with the one step in the right direction. I will say that we've seen over the past decade, we've seen increased focus on this. There's realization all the way from the FDA approving these new drug applications to actually biopharmaceutical entities themselves realizing a challenge that basically the trial participants of any given clinical trial for a new drug should roughly match the epidemiology of that particular disease. And so you shouldn't have a trial that has 90% Caucasian males and 10% minority. Generally, clinical trials should match what's happening in the patient population there. So we're seeing some steps in the right direction. One of the things will be interesting to see is that what kind of self-policing the industry will do in this regard, because when we talk about diversity in clinical trials, we know that a more diverse sample size is better for science. We also know that it's important for testing the efficacy of the drug, make sure that it matches the epidemiology of the disease. So we're seeing movement in that area.
But you'd like to see more.
Absolutely.
Do you like to see more?
Absolutely.